Hello everybody, April 9th. Welcome back. Big day, tough day, emotional day. Call volume is increasing. We're feeling the pressure here in our clinic. We're adjusting on the fly as best as we can. Let's get right into our national numbers first. Yesterday, 418,000 cases. Now we're at 455,445 deaths in the United States. 14,214 yesterday, 16,114 today. About 2,000 deaths a day still. Very sad thing. Straight to our county. Numbers, cases yesterday, 65. Now we're to 72. And still just the two deaths, 58-year-old man and 88-year-old man. Again, on hospitalized data of the 72 people that we have confirmed positive for COVID in our county, we still have somewhere between 2 and 6 people admitted to the hospital. Depending on my source, the numbers are different. If we can get better data on that, I will bring it to you straight away. Straight over to COVID testing sites, they remain entirely unchanged. Trinity Clinic is not the only testing site in the county. There are several. We invite you to call any of these if they're nearby you for questions. Let's get everybody tested. We need to. Let's get into our flatten the curve for Marion County. We're going to be quick today. So this is our numbers from Tuesday, Wednesday, and Thursday. I just wanted to track this a little bit so people could kind of see the trend here over time. So let's draw our 4-9 admissions. There are 512 people admitted in the hospital today in Marion County. So 512 is about right there. So I would like people to see, this is the first time that we have a significant jump up. This does not necessarily mean that there's a bunch more COVID patients that have gone to the hospital overnight from yesterday. All that we're saying is that there's now 512 people admitted. They could be admitted for anything, maybe COVID, maybe pneumonia, maybe heart attacks, strokes, etc. So you can see on this line, if this curve were to continue going up, then we're going to get into trouble. Remember, our capacity in our county is 1,100. So we now have 512 people admitted out of approximately 1,100 total beds in our county. So it is up to the people of the community to keep that number low. We all need to continue our good work with mitigation, hand washing, wearing masks when you're out in public, and just don't go out if you don't have to. We're on day number 7 for our 30-day stay-at-home order in Florida, and we need to get into gear as a healthcare community. We're going to be starting our finger stick clinic tomorrow. This is the antibody test that people have been hearing about here over this last week or two, and we're going to operate a dedicated clinic just for finger sticks. Just call in and let us know that you may need to have a finger stick done or you'd like to have a finger stick done, and we're going to do our best to accommodate everybody we can. We're happy to report that we have received some PPE material from the county. I'll see a little bit more about that later in the video. Also, some other doctors in surrounding counties have reached out to us to ask how we're operating our clinic. They want to try to get something similar to what we're doing up and running in their own offices, and so we are happy to help any physicians and clinics in the area or anywhere around the country for that matter that would love to operate a model something like we're running. So we invite any other clinics or any other doctors to give us a call, and we're happy to help you as well. It was a big Thursday, a tough Thursday, and an emotional Thursday. We're feeling the pressure and the weight in our clinic of this, and we're going to do our best to rise to that occasion. Roll this tape for our Thursday day. Thank you very much. Action. There we go. The moon suit.
A marshmallow. The marshmallow's gonna get you.
Venkman. Where's Venkman? This afternoon we're doing some finger sticks, and this morning we're doing some swabs.
I learned that in pregnancy class.
You learned what in pregnancy class?
Breathing.
You learned how to breathe?
Yeah.
You didn't learn that when you were a baby?
No. No, I didn't.
Okay, so these girls are getting ready for our first swab of the day. Yes.
So I have a healthcare worker on the phone who tested for COVID on the 31st. Got his result yesterday. He came back positive.
Oh, okay.
So his question is, can he, and if he can, how long does he have to wait before getting swabbed again?
2 weeks.
Okay, so he has to assume his wife is positive.
Anybody, the health department should be doing contact tracing. Yeah, as long as he's confirmed positive now. From the day we get the confirmed positive is when we start the 2-week timer for people to quarantine. And
So
for sure,
would be day 1.
Yep, and so for sure everybody in his household that he sort of lives with and all of those people are assumed positive.
Okay.
So they're all quarantined for 2 weeks.
Okay, all right.
Yeah.
Thank you. I'll let him know.
Yep. So aren't we up to PUI 35, right? We've done 35 now.
Yes.
All right. After Kristen comes back, we're going to be ramping up the volume of testing so we can fill up this wall and fill up more walls in this building. All right. Everybody's busy on the phones. Phone volume is picking up, so we got more testing coming.
SK here. I just got to the pickup site for the EOC for supplies, so it's pretty interesting. We're all waiting in a line for pickup. There's an officer that greets us and then is apparently going to give us our supplies for the offices that have requested them and faxed over orders. All right, we'll see what we get.
All of it. Can you carry it?
I got it.
What do you got there?
I don't know.
This is
I'm
from
so
the
excited to
emergency
open it.
management
What is,
that we signed up for.
what is that?
N95 mask,
This was the free.
gloves.
Yes!
More gloves. I think these are surgical masks.
That's what it looks like.
Level 3 surgical masks.
Watch out, you're about to swallow Lysol.
This is crazy.
Why we got a little thing over there?
Yeah, and I think he said these are the cleaning supplies, but I could be wrong. Because I'm not smart enough to open them.
You want some help?
You need the screwdriver?
No, you just use your hands.
Am I pulling
There's a
the wrong
trick.
part?
Wait,
Am I pulling out the wrong part?
I thought you had to push it up with a screwdriver
Nope.
the first time.
You just rip at it.
No, you can't.
You just rip it.
Here, I'll hold the
So
bottom.
like, as soon as I go. Oh my god, I'm gonna fall!
Oh my god.
Wait! Look! It's coming! Wait, look! I can get my finger in, but if I let it go, I'm gonna crush it. Oh my god!
Y'all want some? Y'all want...
My finger's stuck! Oh my god!
More N95.
We got Clorox wipes!
Gloves. Cleaner with bleach, garbage bags, paper towels.
This is amazing! Look at this!
I'm tired now.
Did I just drug you across the floor? No.
You bringing N95 under that? I am. You don't even need the top one then.
You don't need the
Serves my N95.
Oh, I see. So you're going to protect your N95 with a dust mask over the top of that.
More use out of it.
Is that N95 a little more comfortable? Like it sort of fits better. And,
Nicely.
yeah, those N95s do it. Right? This is PUI number 38. Her illness has been kind of a protracted illness. It's been something like 3-4 weeks. So would she have antibodies by now if it were COVID? She should. So let's finger stick her and we'll swab her too. This is weird because she was sick, then got better, then got sick again, which can be characteristic for COVID. I'm curious to see. If you need anything, you call us and let us know, okay?
Okay, great. Thank you.
All right, you're welcome. Bye.
Bye-bye.
Okay, so this finger stick is looking negative. Yeah, that.
Where's my scissors?
I don't know.
Forget this.
Should I want scissors?
Something!
Look right here.
Give me the pen. Push it right there. Put your finger.
Wait, scissors.
We're good.
We don't have to open.
We're like ravenous animals. Like,
What is this? Why did they say
bubble wrap for Angie.
What? Oh my goodness. And they're supposed to be the itty bitties.
Come on.
N95 mask unavailable. Oh, those
Gowns.
are gowns.
Gowns.
Those are gowns.
We have gowns.
And bubble wrap for Angie.
Oh, yeah.
There you go. Alright,
I love this stuff. You know, this whole day.
Right?
Unboxing. It's
Do you
great.
need that?
She's shortness of breath, cough, body aches, fever, 101, chills, headaches. She has lung issues. She suffered with really bad pneumonia not too long ago, and it scarred her lungs really bad. She was on a respirator, and she has asthma.
It's totally Kelsey's fault. It's regular.
Yeah, definitely test her.
We got another one, this one here. She's not feeling good. She's been on our watch list for a few days. She came from the prison. Somebody came out positive. Are we doing anybody that comes from the prison because there is a positive in there?
Probably.
Okay, so that's going to be on ours for tomorrow.
Okay.
So I just want to double check because we've had 2 or 3 people call.
Okay. So we're going to make a good strategy for Monday then, because we're going to have lots of tests for Monday. We can get her on for tomorrow. She's worsening. You're telling me she's worsening?
Yeah, she's worsening. She's concerned. I think didn't she come from the prison?
Yeah, some of the other ones.
Yeah,
somewhere else.
She had in here. Getting a lot of-
Anybody that we know that they work in some ward, some facility, everybody on my floor, whatever, that there's somebody tested positive on my floor, then we're going to try to test everybody like that.
Yeah.
Oh, well,
Yeah.
you are fast.
Yeah, I don't like to let
You should run our finger stick clinic.
Show up like this.
Oh, I should.
So I'll be getting with you then in the morning to
Yeah, I
have you explain to me what you want to do.
Yeah.
Because I want you to design it the way that it works for you.
Yeah,
you
I'm
know?
gonna put a table in there this afternoon and like just think about it. And then,
I'll go over tomorrow what needs to be on the note.
Okay.
Extremely brief.
are we doing these paper notes?
It'll be a paper note.
We could do it this afternoon.
If she wants
Yeah.
to come in,
This afternoon?
Yeah, if we could knock it out. Yeah, that might be a good idea to get her to come at maybe 3:34.
Yeah, if she can make it. If not, it's fine.
Introduce yourself because you're gonna. Wow.
Thank you for watching my TED Talk.
I feel like I need to step out of the frame.
No.
Get out
What do
of
I say?
Tell them you're gonna operate a COVID finger stick clinic for us starting tomorrow.
Hey y'all. So when you come in, you'll see me, and I'll stick your finger and get your results to you pretty quickly. So
How long does it take to get results?
about 10 minutes or so, not long at all.
And how much does it cost?
We'll accept lunch. We like lunch.
I'm not gonna be able to use any of this
I really don't know what to say.
because we're created equal.
Let's start over.
Says so on the shirt.
I'm Kelsey. I'm going to be operating the finger stick clinic. So when you come in, I'll stick you, get your results to you in about 10 minutes or so. It's a quick little visit and you'll see me.
Hey, Doc.
Hi, how are you, doctor?
I'm outstanding. How you feeling?
Very good, very good.
Are you doing the coronavirus testing?
Well, I do have corona, the kit, through LabCorp and through AIT.
Yes.
I have done testing, like around 15 people. They just came and they had some dry cough and they were so scared. And
We're not expecting our peak until the end of April into the beginning of May. So I would be anticipating, at least here in our clinic in our county, and I would imagine it would be roughly the same for you, is that over the next 2 to 4 weeks, I would expect you and me and all of us to have significantly increased call volume asking for testing. And the way that we're approaching it here is that we are doing our very best to accommodate as many people as we possibly can so we can find as many positives as we can. What are your goals, or what are you hoping to achieve in your clinic here over this next month or so?
well, I have my routine patient that I am helping through telemedicine just for their refills and their need. I do want to help the community to test more people for corona. I mean, I would call it a screening, because if they're active and they may go to the hospital directly, so more of the screening to the fact that I protect myself and my family, not to do something wrong that I get exposed and I get infected.
Yes.
Those are my goals, actually.
That's excellent and admirable goals. We are just at the end of the 4th week of the big push that we've been doing in our clinic to try to understand how we can restructure our clinic operations, plus how do we protect every single member of our staff, and then how do we test as many people as we can test, and to juggle all of those things and make it work. And we've worked very hard. Help me to understand a little bit better about what kind of staffing you have. Are you the only provider? Do you have other providers with you?
No, I am the only provider. You know, in a regular base, I have 3 staff, and they are all multifunctional front and back office.
That's an excellent group to have those people cross-trained like you do. So that'll give you some flexibility in terms of making adjustments.
What do I have to do at this moment, at this level of operation? And now you know how I operate.
Yep. So here's how I would be applying the method that we have here in the context of your own office. I don't want to risk anybody. So any contact that any of my employees have with any patients whatsoever, they're masked and gloved at a minimum. Anything that comes inside our building, that could be a delivery of food, it could be a package from UPS or FedEx, even our mail, everything is Lysoled or wiped down, so we have strict precautions for not letting this virus into our building. And I would encourage you to do the same. So we can include that the patient doesn't even have to come in the building, nor do we even have to handle their driver's license or insurance card. We can just get the copy from them. And then that's already on the chart for when the coronavirus swab person goes out into the parking lot and they do their swab. Usually we're going to do the flu first, make sure they don't have the flu. And I explain the procedure that the nurse is going to roll out next to their car. They need to leave their window up the whole time. The nurse will prepare the swab. She'll turn around to the window. The patient is to clear their throat and cough to be sure they can hold their cough before they roll their window down. When the patient is ready, the patient rolls the window down. The nurse will swab the nostril and the patient rolls the window straight back up. And so that
is it through nostril or through pharyngeal?
We are doing the nasal here.
Okay.
So, but it could be either. It could be the throat or nasal. Whichever you prefer.
Okay. Yeah. And then the other question is, how do we protect the staff not to do anything wrong? Gear, the face mask, face gear, all of that.
All of that. That's right. It's full gear. I don't know if you've watched any of our videos, but you can see in the videos that they're fully geared, almost as if they were working in an ICU. I want to take extreme measures to protect my staff and myself and my family. We started work on this a full month ago to obtain all these things, and we've gotten some donations in as well that helps to fuel the supply that we have. Your county health department will have an emergency operations in place, and you can make a request as a physician who wants to do testing for any PPE material that you need: face shields, face masks, gowns, gloves, Lysol wipes, hand sanitizer, the whole thing, and just about anything that you need.
And they provide it?
Yep, based on the supply. It's free. We just went and made a pickup this morning. We got like 80 N95 respirators. We got a bunch of gowns and gloves.
And the supply, I have to get it from my county.
Your county will have an emergency operations that's already in place. It's
called Orange County Health Department Emergency Operation Department.
There's going to be an administrator of your local health department for Orange, and that's the single person. I don't know the name of yours in your county, but that's the single person that's sort of generally overseeing most of what's happening in your county. That's something that's a partnership between the health department and your local sheriff's department.
Okay.
And so that's actually who you would call. In fact, she may be able to get you the number. There'll be a form, and you can just make the request for anything that you'd like to order. They'll let you know where to come and get it. If they have the supplies and you made the request, then they'll be able to get you most of that material. It's impossible to order it from anywhere, places that you might order all the supplies from that you normally would. I'd be surprised if you could find anything like masks and gowns and gloves. Most of that's cleaned out and has to come from the Washington level, and then it distributes into the states, and then the states split it up into the counties, and so there is a supply chain there, but that chain has been running now for the past few weeks, and so you should have supplies in your county already rolling in for facilities just like you because you want to do testing.
Let me ask you something.
Mm-hmm.
Everything you told me, they were super nice, very well done, explained. I understood everything from A to Z. The only thing is, I generally don't receive any call that anybody asking for this. How can I advertise myself to get patients into the door? Because as of now, nobody calls here asking for corona tests in the last few weeks.
So I'll tell you a couple of different ways, and you can do any level of this that you want. Number one, once you are an operational testing site, if you're only able to swab a few a day, that's cool. You can still be listed as a testing site in your county, and that's something that you can do through your local health department. I have also called the local news out to my office, and a couple of different news stations have been out here. And so I'm kind of advertising it on our local news as well.
Do they charge you for that?
Oh, no. I mean, it's a news story. I'm a local doctor. I'm looking to kind of expand, the testing, and we're doing it right here in our parking lot. And
so blessed I'm talking to you, doctor.
Yeah.
I can't believe how this is amazing for helping me, with all this situation.
My all-star assistant that I have, like you have all-star assistants here, has just handed me the Orange County Emergency Management phone number, if you'd like that.
If you please, let me just write it down. I really appreciate it.
Sure.
Okay, go ahead.
All right, Orange County Emergency Management and then your county health department.
One thing is missing that I want to ask you is it possible for you to send me those local news phone number that they came to? At least we can approach them as well.
Oh, yeah, sure. Also, your local newspaper. And then again, it's really important that you get yourself listed with the health department as a testing site. And so that would be one of your first calls. Because
Okay, this is through that numbers you gave me.
Right. All the PPE material that you're going to need, you're going to get through the Orange County Emergency Management. That's the first number I gave you. Then listing yourself as a testing site and getting that support goes through the health department, which was the second phone number.
Very good, very good. Let me just go ahead and move with all of these tasks you gave me. I really, really appreciate. You can't believe how much I can appreciate with all this information that you provided.
It's no problem. If there's any other questions that we can answer for you,
I'll text her.
You can shoot her a text and she can get back to you pretty easy and quick, and she might have the answer right on the top of her head.
Okay, very nice. Thank you so much, doctor. It was good to talk to you.
Great, I'm very glad to help you. Spread the message. All right, sorry, I pimped you out on that a little.
You just literally just throw it all out there. Can you pass me some alcohol?
If we can help our county and we can help our neighboring counties as well, I want everybody to know that we are not just working for Marion County, although that's our focus because we can control Marion County to some extent. But that does not mean that the work, the efforts, and the message that we have couldn't translate into the surrounding counties. We're talking about Alachua and Lee and Lake and Sumter and Orange, and give me some more counties because I'm bad at geography.
I think you got them all.
Okay, right. And so anybody that's in those counties, if you're watching, we appreciate you watching, and call your doctors and call your health department and get them doing what we're doing. He is an active lung cancer patient. He received radiation recently. He also got his first immunotherapy treatment earlier this week and started spiking fevers within the last few days. So he's not particularly respiratory. He's got like a chronic cough, but really nothing worse than his usual. So, but because his symptoms developed so recently, will the finger stick help us? Not really right in this one. So I did a finger stick on a lady who had been sick for 3 weeks earlier because, hey, maybe we'll catch something. So let's hope he's negative for everything. So, because he was in a facility, a healthcare facility to get this, and so risks are higher for him. So that's it. You guys are good to go.
We just got a phone call. She doesn't have a fever, but she has a real persistent cough. Just came back from New York because she travels for work. Body aches and chills. Yes, her chest is very hard to breathe, shortness of breath. She wants to know if she should be tested.
Absolutely, she should be tested.
Okay, so I'll try to add her on for tomorrow.
Holy cow.
Yeah,
she's
like-
traveling to New York.
She just came back from New York in March. She said towards the end of March. She came back. She travels for work, and she went to all the states in between as well. So,
I can't wait to have a chat with her. Traveling to New York. This is why that's not important right now. There is a global pandemic, and
yes.
people are dying from this. We're approaching the end of another week of dealing with this national emergency crisis here in our county and surrounding counties as well. It's good to see people wearing masks, though. I'm damn proud of people of this community. They're paying attention. There's still a lot of traffic on the road, though. Still seeing a ton of traffic on the road. But I'm happy to see more masks being used. People are using gloves. They're keeping their distance, and that's encouraging. We're feeling the pressure of this fight here in our clinic. I can only imagine the struggle of the people in New York City and around the world that are fighting this. This is hard, but we're not going anywhere. We're going to be here for our county, our community, all the way through to the end, no matter what.